My name is Deb Bryant. I'm from Oregon State University's Open Source Lab, and I'm pleased to follow Tim's comments because I'm mostly interested in talking to you about why it is important for people in this room, if you're not already working on healthcare IT issues, to join in. I wanted to tell you first about why I got involved in health IT, and then I'll tell you a little bit about my perspective. My dentist is actually someone I like. I don't know how many people can say they like their dentist, but my dentist is a geek, and he loves to talk about polymer resins and tell you why they don't put silver in your teeth anymore. He comes from a family history of medicine. His great-grandfather was a Chinese medicine practitioner in Central Oregon, came over and treated people that had no other doctor. Many years ago, there's a museum out in the middle of nowhere called John Day, Oregon. That's a testament to his dedication to people. Well, I've seen my dentist for about 25 years, so every once in a while when I change jobs, he asks me about what it is I'm doing for a living. And when I told him that I'd gone to work for the OSU Open Source Lab, I figured the conversation would be very short because it's kind of a heady subject. And he said, well, I use open source. And I said, you're kidding. You use open source to manage your records or just manage your... No, we use open source to run our entire practice, including managing our health records and conveying that information to public health agencies. This is 7 years ago. I was astonished that someone would do that. I found out later that he actually also had a degree in information sciences. And he shaped my thinking about healthcare. I had never really thought about medicine essentially being an information science, that the care that you're provided, that the care you get is as good as the information that you're provided, that your physician has. And there is the heart of the problem in healthcare, and particularly in the United States. I'm going to talk a little bit about what the challenge is and what some of the opportunities are and what some of the great things government is providing as a result. My system's over here. To help you understand a little bit about my context, I work for the Open Source Lab at OSU. For people that are involved in the open source community, they recognize some of the major projects we support. We have the infrastructure for Linux Foundation and the kernel development, the infrastructure for Apache Foundation, and we support many large and nonprofit projects, and also some government projects, including one that Tim mentioned today, the Kinect project, which we think it was really quite a significant project. My job there has been to take what we learn about open source community and supporting them and how those work and convey that knowledge to the government sector. So my specialty is focusing on supporting government agencies, state, local, and now federal, in their interest in using open source. I also have a passion for the topic of healthcare IT because the opportunity to make a high impact is huge in this area. We'll talk a little bit about why these things are so important together. So 1.5 million people are harmed by medical errors, medication errors every year. That is due directly to either having wrong information or having not information available. So you think about how you get your care today. If it was 100 years ago, you had a doctor show up to the house with a black bag, and he knew pretty much everything about you, maybe things you didn't even really want him to know, and he was going to tell your mother, but he knew everything about you. Today, people get their care from a variety of places. I mean, does anyone here actually have only seen one doctor their entire life? You have specialists. You see dentists. You go to emergency rooms. You go to immediate care centers when you travel. You may have, if you live in a big city, you may have had your prescription filled at 4 different pharmacies because you moved around town. So imagine the challenge when you go in for care if that information is not there. And that becomes a problem of systems interoperating. In the United States, this is a particularly thorny problem because in contrast to, say, someplace like the United Kingdom, where the government is responsible not only for the care, delivering the care itself, they also have all your information. In the U.S., all of our information is scattered everywhere, and the systems that support providing the information about your care are not built to talk to each other. They're built to deliver that service and take care of you while you're in front of them. So I'm going to talk a little bit about what the government is doing and why that's important. And one of the projects that Tim had mentioned, again, was the Kinect project at in the federal government. And I am not going to spend a lot of time talking about the detail of that because you'll have the pleasure of hearing David Riley talk about it later today. But the government makes significant investments in open technology. They make significant investments in technology in general. They spend a great deal of money on technology. And the way they invest in technology and the decisions they make set de facto standards, whether it's an explicit standard, and we'll hear about this today in the health IT area, or whether it's simply that they're consuming something that everyone builds to as a result. So just a little bit of history. The interest in the U.S. government and in the area of personal health records, because this is really a very key concept, is that under the Clinton administration, they were interested in creating medical records to be available to everyone. There was no policy. There wasn't a dollar attributed to that intention, but it was expressed during the Clinton administration. During the Bush administration, they actually issued an executive order and set out a 5-year timeline. And the federal government set up a framework and an office within Health and Human Services to work on that issue. But there was no dollar associated with it. So a number of years went by before great progress was made. Under the Obama administration with the American Recovery Act, there have been quite a few dollars. $2 billion has been invested in healthcare IT. Under that, most of that has gone to extension centers, universities, research, and workforce development. In other words, training the next generation of folks. So I wanted to talk about the Kinect project a little bit. This is an application that was developed for internal use in U.S. government, so government agencies could exchange information. And they, I believe it was this last spring, it was released under the GPL. BSD, excuse me. Thank you very much. About a year ago. Okay, thanks, but who's counting? Time's whizzing by. So it's available now as an open source license. And at the time last year, one other agency used it. That was the Social Security Administration to convey records. Today, it's used by 7 federal agencies. That includes the DoD, which is a pretty significantly sized agency. So the uptake in using a system that's open source is large within the government. Well, what are the implications for that? Firstly, this particular project has been exemplary in that they have taken the open source development model and the community building model and used it nearly as a complete overlay. They're using the same kind of project management and what we used to call hackathons. They're still called hackathons. This is really the only variation is that for government purposes they call them codathons because hack is not a great word in the government space. But again, the project is an exemplary one, and it will probably be a proof of concept as whether you can do more projects like this within the U.S. government to use that model. So I had a great conversation with David. We talked about what about sustainability, this kind of project. This is always an issue for all of us in the open source community. How do you keep a project going? How do you keep it resourced? And how do you keep people engaged? Well, in the U.S. government apparatus, because they do such a long time planning and budgeting, it's unlikely that the project will go away for some time. You know, they have a growing number of stakeholders, and so it should go on for some time. But the other side of that coin is that budgeting is a public policy process. So when you budget in government, you also are subject to someone changing their mind about how they want to express their policy by opening up their checkbook or creating the bill that creates the law that creates the budget that the agency gets to use. So one of the problems that this project and others will face and noodle on in the coming months and years is how will you sustain these kinds of projects as an open source project? Does there have to be an entity outside the government that helps facilitate the long-term view of these projects, or will they continue to be run under the auspices of the government? That's a question for people that are interested in that space to come help solve. Now, there are people in this room that are far more qualified than I to talk about meaningful use. But meaningful use is essentially the expression of the standards that you will need to meet to be able to use electronic health records. And there's a carrot and there's a stick. The federal government is handing out monies to doctors to be able to invest in electronic health record systems. And the new standard, the information that's just released recently, explicitly calls out open source as a possible use. So there's no longer a debate about whether it has to be an existing application that meets a legacy industry standard. There's an opening for open source as well. The other piece that was really interesting and compelling about the way that the final definition of meaningful use came out is that it explicitly calls out for electronic health records to be available to individuals. This is really huge, and I want to touch on this a little bit when I talk about personal health record banks. But those rules have come out. The stick is that if a doctor or a hospital or a clinic doesn't comply with these rules and have these sets of standards so you can move information around within the rules, then they won't be able to receive any money from the federal government through any investments they make in healthcare. So that's a great way to make that happen. So I mentioned electronic health records in terms of personal information. This is an area that I would encourage developers to get involved in and think about, both on a personal level and a technology level. We mentioned that there's Microsoft and Google have health vaults, personal health applications. I don't know of one that's open source today. We also know that the world is moving to mobile. So we may think about web applications today and being able to get your information on the internet, but my kids' are not going to be using the web to get their information. They're going to be walking around looking at on their phone. And that's by statistic, that's by study, that's by very solid research, is that everything is moving mobile. So if you're thinking about developing any kind of health IT application, and I encourage you to think about patient-centric applications, that is something that's a great opportunity for people that are working in the mobile space. So I want to say that I really want to emphasize the importance of the work in the healthcare area. Information technology is an important enabler. The electronic health records area is really quite key. When you go back and you look at the number of people that actually die from medical errors, the estimate reaches 100,000 a year. That's the equivalent of having a Boeing 737 crash every day with all of its passengers dying. More people die from medical errors than breast cancer. More people die from medical errors than AIDS. And it's a problem that can be solved. We don't have to have a cure for cancer out of this room to be able to go solve an information technology. It's a great challenge, but it's something that I really encourage people to work on. And I think what I want to do is make my presentation a little bit shorter. I had originally intended to do a review of a lot of the open source projects available today. There's a great list of them. But Fred Trotter is here to talk about open source, and there's no one better to do that on a project level than he. And he'll give you a deeper dive into the technology and how some of those things are working. I'd like to give you an opportunity for some questions. And if you ask me a question where there's someone who's better to answer in the room than I will be happy to share that stage. But I really I appreciate the opportunity to frame this as an opportunity for the open source community to come out and take a look for how we can solve this problem, really to the greater benefit of people. And also, remember, it helps reduce costs. That seems secondary to me in terms of human factor. But if you think about the care that's given at the point of care where people are making decisions, if they don't have your test results from last week, they're going to order that test to be done again. And if they don't have the right information, they're going to order a procedure that may not be the right one. So help us help people, help us save money in healthcare and spend it on helping people rather than just spinning our wheels. Thanks very much. Appreciate some time to share some ideas with you. Have any questions? Comment? Yes. I would be happy to do that. Do you have any questions from the floor? Comments? Yes, here for. Sure. So the question from the floor is, what do we see in terms of privacy? How do we see handling the privacy issues that come up if you move from the physician completely owning your information and it's on the shelves today and it's not going anywhere? If you're moving around a network, if you're moving into a third-party repository, how do you address those privacy issues? And is there somebody, I know we have several experts, and maybe we can give a short answer. I see Richard Sears is here from Friends of eHealth. Would you like to take that question for us? And here, let me bring the microphone over to you. I'd like to record your answer.
Thank you. If you force all the providers to put data in a common repository that you control, according to the HIPAA regulations, you have control of that data, and however you use it, you're legally free to use it. It's when you're talking about crossing business barriers that HIPAA comes into compliance issues. But once you have your data, you can do whatever you want with it, whether that's in a healthcare record bank, whether in fact that's in Google or up at Microsoft Shop or any of the other schemes that are now being floated to consolidate and aggregate personal data. The issue is whether in fact you can get your data. And you really have a business case problem right now where you've got these people who own large healthcare organizations sort of duking it out on how they can monetize this huge repository of patient data. And so it's really, in many ways, it's a business model issue being played out at the policy levels in D.C. right now. But once you own your own data, you can do anything you want with it.
We're going to have another comment.
Sure. I'm Hugh Creedon from DSS. And it's an excellent question and one that has not been answered because, as our last speaker mentioned, if you have your data, you can do whatever you want with it. The problem is if I wind up in an emergency room, unconscious, unresponsive, that's where the whole question of interoperability comes in because I can't control my data, but I would love to have the ER people have access to my data. And that's one of the real problems that we're trying to figure out, and I don't think that solution has been breached yet because there are restrictions by HIPAA and there are mandates through the ARRA saying meaningful use has to include interoperability. So we're all still working on this, and it's a complex issue.
Thank you very much. I have someone in the back row here. If you have a comment, come on up. I will repeat your answer. Come on up. Thank you.
I'm Steve Bedrick. I'm from Oregon Health and Science University's Department of Medical Informatics and Clinical Epidemiology. And I just want to point out the ER Snare is a really good one, but there is a solution. And cities that have done RIOs or regional health information organizations or whatever acronym you want to use today have solved it. And all the participating clinics and hospitals agree to pool certain elements of their data and make it accessible to other participating organizations in certain circumstances. And in that particular case, they are able to get at least your drug allergies and some basic data elements if you end up in the ER, as long as they can identify you. So there is a solution. It just requires a lot of political and financial wrangling and some non-trivial technical things as well, which makes it kind of hard to adopt in any kind of universal way.
It's only a partial solution because I'm from Chicago.
Well,
I understand. I think the suggestion is that it's a model that has applicability to other areas. So it's an approach. Thank you very much. I think we have time for one more question.
So in the face of all in the face of all the incentives to move healthcare to EMR, does something need to happen to HIPAA to enable that? Is HIPAA broken because it was created before a lot of this incentive was created?
That's a good question. I see some head shaking. Yes, Tim.
I have an opinion on that, which is not a sort of informed legal opinion and probably controversial. But it seems to me that we need to rethink everything we take for granted about privacy, because it's pretty clear from the technology that it's going to be very, very hard to keep virtually anything private anymore. Our devices give out way too much data. It's stored way too ubiquitously. And even though you keep individual pieces of it private, it's possible to reconstruct who it belongs to with a remarkably small amount of data. And therefore, there are going to be people, maybe bad guys, maybe good guys, who are data mining, the tracks that we leave in cyberspace and figuring out things about us that we didn't want to know, didn't want to be known. And so all of the current thinking is a little bit like the French thinking after World War I, where they built the Maginot Line. We're going to build these walls to keep this information safe, and it's just not going to work. And so instead, I think we really have to move to a regime in which we assume that information can be known and that there can be bad outcomes, and that we actually punish the bad outcomes rather than just trying to prevent it from ever happening. So a great example to me in healthcare privacy is one of the reasons why we have so much focus on healthcare privacy is because insurance companies do adverse selection once they know that somebody has a health condition. So rather than trying to prevent this information from leaking out and treating it like it's some kind of toxic waste, we need to basically say, we need to solve the adverse selection problem.
Oh, thank you. Well, yes. Okay, we have time for one more comment. Absolutely. Come on up.
Just a follow-up on that last comment. What we're missing in the healthcare privacy issue is, we've been looking at technologies to do things like encrypt, limit access, and so on. But there's actually another analogy to look at. Who remembers the New York shirtwaist factory fire from, I think it was like 100 years ago? As a result of that, you can no longer lock the exit doors, but you can put alarms on the exit doors. So we actually need technological solutions that are sort of like the break the glass analogy, which basically says, you can't go through this door, but if you do go through this door, it's going to set off alarms, and people are going to be alerted.
Can you identify yourself for it? Yes, thank you. All right. Well, I appreciate you letting me start the conversation. And this track is all about that. There are a lot of people presenting today that will want you to meet them. It represents a range of projects and cross-industry folks. And I think we're out of time. We're going to move to Fred. Well, Fred says he's got some time. I see someone in the very back. You want to come up? Because we'll put you on mic. And with the last gentleman that spoke, could you tell me what your name is?
It's Tim. K.S. Bhaskar. Tim.
And where are you from?
I'm from a company called FIS.
Okay, thank you.
I've been associated with the visitor community.
Thank you very much, Mr. Bhaskar.
I had another question. On the previous question, perhaps that's an opportunity to marry e-government with, IT health. But another troubling question for me with IT health is availability and reliability. Software fails, and open source is no exception to that. So is there any way to sort of bridge the gap between failure in software and the IT health world? Because health cannot fail.
Yes. So this is an important piece in an open source model and development. As we've moved out of doing infrastructure into doing applications, what we've learned is we have to have the domain experts involved. I mean, that's a general comment. Did someone else want to contribute to that? Yes, Richard.
There's a wonderful study that addresses this issue because it's kind of an oxymoron. And it's been done by Halverson, who is the CEO of the Kaiser Health Systems, and I would recommend his last book. Healthcare is about one sigma, okay? Those of you who understand this should be running for the doors. When you're pushed to build a 5 or a 6 sigma system, okay, and there's some of you out here that are probably developers that have had that drone in your ear, and I know you've done all kinds of development practices, and the fact of the matter is healthcare doesn't even come close to anything you're used to. So any improvement in healthcare is great. So it's one of those false choices. Can we sort of stop? Are we going to have an error rate that's so high that you don't want to adopt health information technology or software? And I'd say that's just a false choice, because if you did have that error rate, most doctors would, pardon the pun, die for it. Healthcare has an abysmal error rate, and it's about 1 or 2 sigma.
Thank you very much. Any other comments or questions, discussion here? Yes.
So, off of the privacy stuff, you kind of, you and others are asking for kind of more participation. And you mentioned a little bit that, so we're talking about open source moving kind of from infrastructure to application development. A lot of open source development community is motivated by scratching an itch. And one of the issues with healthcare is that most people don't really care about healthcare until it's a problem. So a lot of things like personal health records really don't get used by the general populace, right, until you have a serious condition. And so, I'm wondering if there's any thoughts or comments on how to get people involved when they don't have an itch to scratch.
Okay, so the comment in question was the open source community traditionally reacts to an itch that needs to be scratched. And that's something immediate and tangible. Healthcare issues, people respond to when they have a crisis. And we're using personal health care records isn't part of our culture right now. We don't think about it, never think about it. Like we do with the bank. You would be upset if you couldn't get all the information from your bank in one place and know what your checkbook balance was. Well, you can't do that with your own health records. So it's a great question. How do you move? We're starting a dialogue. So my reaction would be, we're starting the dialogue. This is the first time the O'Reilly Conference has had healthcare as a track. 2 years ago, I produced a government open source conference for government management. We had a track on public healthcare IT for the first time, and that dialogue is continuing. I think the more we make these projects available and tangible, the more we'll be able to bring in the community, particularly when we make it easy for them to participate. And so I think we're trying to work from both ends to meet in the middle. Yes?
Another privacy concern is that of the doctor's personal notes. They may take down information about you that they do not want to share with anyone else. And EHR, great, but you don't want them to not remember things about you.
Thanks. Yes?
Everything that goes in an EHR is admissible in court. So that's another thing to think about. It's all admissible in court.
Oh, okay, so the comment was everything that goes into HR is admissible in court. So it's another thorn in the... One more question? All right. And then, Fred, are you ready to go? All right, last question. I'm going to take it from the woman in the front row. I'm sorry, I had to pick one.
I see a barrier for open source only because, having worked in the healthcare arena for over 20 years, it's very regulated. Any one of the topics you just talked about, HIPAA, ARA, meaningful use, there's also certification. Those are very complex standards and regulations. And it's not just something that, oh, I'm going to develop this particular function. You got to really understand how it connects into the whole process.
Yeah, so the point from our attendees, there's a very specific, highly regulated set of standards for this industry. So it's not like, hey, I think I'll develop an app to tell you where all the drug stars are and everyone's information in it. It's not that simple. It's true. But what we're doing is encouraging people to plug in. And investments are being made in workforce development and higher education, too. I couldn't spell HL7 4 years ago. I can do that now. But the really bright spot is that if I encourage people that are thinking about maybe engaging in a particular industry. There are people that know how to solve those problems, that understand those rules. The Kinect team understands those things, and they encourage participation. But it's you're right. It's not an adhocracy. It's a very formal environment to work in. So I thank you very.
At 4:30 at the Open EMR
Outstanding. Thank you. Thank you. So we'll have discussions about certifying and getting people in open source projects, specific projects certified. I thank you for your time very much. I'm going to turn over the floor to Fred Potter.